certainly agree with Mr. Glenn Gregory of the JBL Group that you should never overestimate the cognitive activity of any government that you may happen to deal with. Now, having said that, I would also like to just thank, on a personal basis, Mitch Shannon of the Chronicle Group of Companies, as well as Joe Knott of Pangea Group, for inviting me to chair today's two Oxford debates. Just procedurally, we'll be reading a proposition, we'll be voting, and then we'll be having speakers, 5 minutes from Ray Chapesiak, 5 minutes from Rob Hamilton, and 90-second rebuttal from Ray, and then a second vote, and then, of course, the movement or the wave of the voting change will, of course, determine the debate winner. And I don't think, Joe or Mitch, we've actually set the prize for the winner. That perhaps we can debate over lunch. Our two speakers, first of all, are Ray Chapesiak, as you very well know, the much-loved and occasionally dreaded PAB. He's Commissioner and Chief Executive Officer. He's been with PAB for 23 years. Having attended actually a number of Ray's presentations, I was most interested to learn from Ray that, and I don't know if this is top secret classified information, but that apparently the majority of complaints that PAB files actually come intra-industry, which is always very interesting. Rob Hamilton, of course, is a very well-known commodity entity person in the pharma sector. Rob is currently the president of Hamilton Strategic Consultants in Burlington, Ontario. We know him very well in the pharma industry for the last 20 years, of course, most recently with UCB Pharma and Biogen IDEC. Now, with that, I would introduce to you the proposition of today's Oxford debate and invite you to vote in either supporting it, the ayes or nays, or les pour, or les contre. And the first resolution is resolved. And do we have that up there somewhere? This House believes that despite making concerted efforts during the past decades, the pharma industry has failed at creating adequate workplace diversity. And of course, diversity itself is becoming quite diverse, but I would invite you to vote. Now, with that, I would invite Ray to please come forward, and he will be given 5 minutes, which of course will be rigorously and vengefully enforced.
Thank you, Dr. Cadre, honorable opponent, Mr. Hamilton, and most honorable audience. For the purpose of this debate, diversity encompasses race, gender, disability status, lesbian, gay, bisexual, and transgender employees. It can include age, religion, politics, or people with high golf handicaps like Rob Hamilton. Well, I agree there's been some effort to promote diversity in this industry. I don't agree it is adequate. That's my point, and here is my evidence. I will speak to a 2007 report, Career Advancement Corporate Canada, focus on visible minorities, undertaken by Catalyst Canada and the Diversity Institute Management Technology at Ryerson University. Recent study. The study was large. It was based on responses of 17,908 managers, professionals, and executives from across Canada. Employees had an average of 20 years in the Canadian labor force at 43 large publicly traded and privately held companies, and also representatives from 38 Canadian organizations. So what did the report say? The report says visible minorities experience lower levels of career satisfaction than their white Caucasian counterpart employees. Quote, while the Canadian workforce is diverse, our workplaces are far from inclusive. Visible minority managers, professionals, executives were more likely to perceive workplace barriers to advancement than their white Caucasian colleagues, including perceived lack of fairness in career advancement processes, an absence of role models, inequality in performance standards, and fewer high visibility assignments. So think in terms of what actually happens. While 58% of senior managers said they were committed to diversity, only 48% of visible minority respondents felt senior management demonstrates a commitment to diversity. We have some work to do. It's far from adequate. At a recent U.S. Pharmaceutical town hall meeting on women of color, recent meeting 2 weeks ago, Leslie Mays, Vice President of Global Diversity and Inclusion for Pfizer, said, I quote, "This is the beginning of a movement for our industry. We're trying to set our industry apart for all women using all the resources at our disposal," unquote. Much work still remains to be done. Instant polling at that conference revealed that most of the attendees, 68%, feel their company is not sensitive to the cultural issues facing women of color in workplace. A stunning 89% said that micro inequities continue to remain a problem. Women of color may say that too often they lack the role models, mentors, and sponsors who are often necessary to help them move up the corporate ladder and get better assignments. Let's talk about LGBTs. That is not a new Tim Hortons sandwich. It's a term to encompass lesbians, gays, bisexual, and transgender individuals. In the U.S., an organization called the Human Rights Corporation Foundation does surveys. I like surveys. And rated 19 pharmaceutical and biological corporations on 7 factors. 16 had scores of 57% or more. Bosch and Lomb scored 100%. So it was possible to do well on the survey. So companies in the U.S. are developing employee resource groups, also known as affinity groups for LGBTs. I'm not aware of any initiatives in Canadian pharma companies. Some work to be done there. Leslie Alexander, President and CEO of the North Carolina Biotech Center, thinks pharmaceuticals and other corporations tend to think of diversity in terms of how many women and minorities, sometimes homosexuals, they hire and have on board at any given time. She says, but what about the diversity of age, religion, nationality, politics, and so on? This is complex and far from adequate. Employers tend to fill roles rather than looking for diversity of all types. Our tendency is to surround ourselves with people just like us. In an article in Pharmaceutical Executive, Reggie Smith, Genentech Regional Sales Manager I met at UCLA last fall at a medical marketing course, thinks there are few different kinds of issues at work. There's a fear of difference. As humans, we like and are more comfortable around those who are similar to us. Second, companies get in the habit of recruiting, and it's from the same sources. The hiring managers lack commitment to diversity and recognition of, this last point is recent, very recent, March 21st, recognition of International Day for the Elimination of Racial Discrimination. Council of Agencies Serving South Asians announced the launch of a campaign titled, Putting Equity on the Agenda. Are we being heard? Capital letters, shouting. So there's still work to be done. So I believe that the pharmaceutical industry has to look at itself, find ways to incorporate diversity in their workforce. After all, Dawn Graham is the first female chair of RxMD, a good start, and that was a long time coming. In closing, I agree that there are companies committed to improve diversity in their workforce. I think there is an effort being made. But take a look around the room. Okay? Don't confuse commitment with actual change. I don't believe we have succeeded in adequate workforce diversity yet at the senior executive level. We're not there yet.